Hey, it's Annie Andrews with The Arena, South Carolina's only progressive media outlet. And I am here today with my good friend, Dr. Joseph Sakran. Dr. Joseph Sakran is a trauma surgeon and an associate professor at Johns Hopkins University. He is also the chief medical officer at Brady. And I have him here to talk about breaking news from the Surgeon General today. We saw the Surgeon General declare gun violence a public health emergency. So I want Joe, please, thank you for being here and break this down for us. What does this mean?
Yeah, thanks so much for having me, Annie. And I think, look, like this is a really exciting day because the advisory by the Surgeon General declaring gun violence a public health crisis is historic for a lot of reasons, but it's something that so many of us as healthcare professionals, and frankly within the gun violence prevention community, have been calling on for years. And I think what this actually does is it allows us to really underscore the urgent need to address the devastating impact of gun violence on communities across the nation. And some people say, well, okay, it's just a report. Like, how does a report even make a difference? I think there's a couple kind of key, points. The first is that this advisory, right, that they've released acknowledges the severity of what we are facing as it relates to gun violence being a major threat to the health and safety of the public, akin to like other like crises like smoking and drug use and infectious disease. I think the other thing that it does is it allows us to really look and emphasize the need for rigorous data collection and evidence-based solutions, which then of course then lend itself into the policy arena where, we of course call on our policymakers to really develop and implement evidence-based solutions and programs that are going to make communities safer. And last but definitely not least is the enhancement and the increase in the public awareness that this does around this issue is so important, encouraging communities to engage in discussions and really take, I think, collective action to address this crisis front on.
Exactly. I couldn't have said it better myself. Thank you so much. I know you've been on the front lines of addressing this crisis really at all levels, from the federal government down to the trauma room at your hospital. And I couldn't agree more. Like you said, those of us who work in the clinical setting have known that this is a public health crisis for a very long time. The crisis extends beyond those of us that we treat who have been shot to their families, their extended families, their communities, children I care for who go to sleep at night and hear gunshots outside their window,
Yeah.
every child in America who goes to school and learns how to hide from a bad man with a gun. The ripple effects of this crisis touch every single American. And so this is a monumental step forward.
Yeah, and I think to your point, I mean, you were reminding me of that one graphic in the report that demonstrates how this public health issue permeates across communities, right? It's not just that one individual that's injured or killed, it's the families, the loved ones, the actual community itself. And imagine, right, this continued, traumatization that happens day in and day out, whether you're talking about, the type of violence and devastation we're seeing in cities like Baltimore, or you're talking about the stuff that we're seeing, across the country, with the mass shootings that are often highlighted and focused on. All of them, right, are incredibly traumatic, and we continue to be re-traumatized day in and day out. So it's important that we really kind of name this what it is, which is a public health problem.
That's exactly right. That's exactly right. And this, is building on some other really important historic steps that we've seen under the Biden administration, which is the passage of the first federal gun safety legislation in over 30 years with the bipartisan Safer Communities Act, and then the White House Office of Gun Violence Prevention. And I know you've been in close contact with that office. So tell us a little bit about why that office is so important.
Yeah, look, I think the White House Office of Gun Violence Prevention, that is led by Steph Feldman, and they brought in, of course, two incredible survivors, Greg Jackson and Rob Wilcox, has done a tremendous job to really be able to be that bi-directional link between the federal government and the local and state entities, which, as you know, right, most governing in America happens at the local and state level. That linkage is so critical because it provides content expertise, opportunities to understand what programs are available, what are the different options and solutions, how can we be innovative, how do we invest in communities. All of those different factors, right, allow us to really, kind of break down the silos that exist and work together across disciplines, whether it's healthcare and law enforcement, education, and so forth, to really be able to have a comprehensive collective action that will ensure that you can walk down the street without the fear of being shot. You can go to a grocery store or a concert or a place of worship. That's the goal. And you can imagine that in November, if President Biden is not reelected, the next administration would likely get rid of that office on day one. And that's just simply a fact.
That is exactly right. Everything is on the ballot this November. For those of us who spend most of our days working in the gun violence prevention space, we have to understand that all of this progress that has been made is on the ballot. And like you said, likely on day one, if Biden is not reelected, this office will go away. And we cannot afford for that to happen. This crisis grows more urgent by the day. More and more Americans are directly affected by this crisis every single day. And I hope that folks understand exactly what it is they're voting for when they walk into the voting booth this November.
Yeah, exactly. That very well put. I mean, health is on the ballot, gun violence is on the ballot, reproductive rights are on the ballot. This election, right, our democracy is on the ballot. This election means a lot, and I'm grateful for people like yourself to be able to work alongside you and, frankly, so many other healthcare professionals that have realized that yes, part of our role is to provide really great clinical care to our patients at the bedside. But there's also an opportunity to ensure that our voice is heard beyond the trauma center, beyond the operating room, and beyond the bedside, right, in order to provide the best medical treatment, which in this case is prevention.
Beautifully said. And I am honored to be at your side doing this work. And I think that every day more and more physicians get off the sidelines and understand that our role is so much bigger than at the bedside. So I know this has been a busy, hectic day for you. I want to thank you for taking some time to talk this through with me. And I'm sure I will be having you back for a full episode of Their Future, Our Pod in the very near future. So thank you so much, Joe.
I'd be honored. It's so exciting, and thanks for all your work, Dr. Andrews.